Stroke is a cerebrovascular event that causes the death of brain cells as a result of reduction or interruption of blood flow to the brain, caused by a sudden blockage or rupture of a blood vessel supplying the brain. It is therefore a medical condition similar to that which occurs during a myocardial infarction, but in this case the affected organ is not the heart, but the brain. Globally, stroke is the leading cause of disability in adults and the third leading cause of death after cardiovascular disease and cancer. 20 to 30% of people affected by a stroke die within a month of the event. 40 to 50% within the first year. Only 25% of stroke survivors recover completely, while 75% survive with some form of disability, and half of these suffer from a deficit so severe that they lose self-sufficiency. Stroke types. According to the triggering causes, stroke can be classified into two different types: ischemic stroke and hemorrhagic stroke. Ischemic stroke, also known as brain ischemia, occurs when an artery carrying blood to the brain narrows or becomes completely blocked, reducing or cutting off the brain's oxygen supply. In general, the obstruction is caused by the formation of an atherosclerotic plaque. That is a deposit of cholesterol, fatty acids, and fibrous tissue, which gradually accumulates in the walls of the arteries until they become obstructed, favoring the onset of cerebral ischemia. Among the other possible causes of ischemic stroke, we find the sudden rupture of an atherosclerotic plaque, which leads to the formation of a blood clot, called thrombus, which occludes the affected vessel, blocking its blood flow. Ischemic stroke is the most frequent form of stroke and accounts for about 80 to 85% of cases. However, hemorrhagic stroke, also known as brain or intracranial hemorrhage, occurs when an artery that carries blood to the brain ruptures, thus starting to bleed and therefore compress the surrounding brain tissues. Among the main causes, we find the rupture of a cerebral aneurysm, medical term that indicates an abnormal dilation of a blood vessel in the brain, a head injury, chronic uncontrolled hypertension, and the rupture of a congenital arteriovenous malformation. Hemorrhagic stroke accounts for approximately 15 to 20% of all strokes and is the most severe form. Knowing the early signs of stroke and alerting emergency services early can save lives and improve outcomes for survivors. Every minute that passes can make a difference. A stroke destroys about 2 million brain cells every minute, and 911 is the only way to arrive on time. What are the symptoms of stroke? Stroke symptoms usually start suddenly, within seconds or minutes, and in most cases progress at the same rate. Symptoms are highly variable and depend on the affected area of the brain and the extent of the damage and ischemia. Let's see what the main ones are. Crooked mouth. In the case of a stroke, there is a loss of control of the muscles in the mouth as the facial nerve no longer receives messages correctly from the brain. If the stroke affects the left hemisphere of the brain, the right side of the body will be affected, and vice versa. This is because nerve fibers coming from the left and right sides of the body cross at the level of the medulla oblongata and transmit information to the opposite cerebral hemisphere. Facial paresis, partial decrease in motility, may occur during a stroke or a facial paralysis where the loss of motion is complete. This is typically a central facial paresis or paralysis, in which only the lower half of one side of the face doesn't move as well as the other or doesn't move at all. The mouth appears asymmetrical and therefore crooked and tends to accentuate when the patient tries to smile. Weak arm. One of the first signs of a stroke is a motor deficit in one or both limbs on one side of the body. That is when one arm or leg has reduced mobility compared to the other side of the body. For example, you have difficulty moving one leg, or you are unable to lift one arm or keep it raised at the same level as the other. When a stroke is in progress, typical symptoms such as pins and needles, sudden lack of strength and loss of feeling in an arm or leg occur. Speech problems. Another sign of stroke is when the patient begins to slur words or use inappropriate or incomprehensible words until he is completely unable to speak. He feels confused and cannot understand what others are saying. In this case, the compromised areas are those of language and the ability to communicate verbally. If even one of these three signs is found, it is highly probable that you are having a stroke. At this point, call 911 immediately. Other signs that can help identify a stroke are sudden visual disturbances in one or both eyes. We speak of hemianopsia and indicate a vision deficit characterized by the loss of half of the visual field, feeling dizzy or falling to the floor due to sudden loss of coordination of movements. Sudden throbbing headache with no known cause, different than usual. The guidelines dictated by the Ministry of Health remind of: don't wait to see if symptoms improve on their own. Don't call and don't go to your family doctor or medical guard. Don't go to the emergency room with your own means of transport. Also, to avoid going to a hospital where at least intravenous thrombolytic treatment is not available. The 911 service makes it possible to identify patients with suspected strokes and organize their transport to hospitals equipped with what are called stroke units, that is, units dedicated to the management and treatment of the acute phase of ischemic and hemorrhagic stroke. How to recognize a stroke. A few minutes are worth a lifetime, so you have to be fast. It is an acronym that Americans use to recognize the signs of a stroke, and it is no coincidence that it means fast, precisely to underline the importance of the time factor. The acronym FAST calls attention to some simple tests that must be done if it is suspected that a person is having a stroke. Ask the person you suspect is having a stroke to smile. If one of the two corners of the mouth pulls to one side, it could be a clear sign of a stroke. In some cases, the facial paralysis is not due to the stroke, but to the so-called Bell's palsy, which takes its name from the Scottish anatomist Charles Bell, who described it for the first time. It occurs as a result of inflammation of the seventh cranial nerve, better known as the facial nerve, and typically causes paralysis of the muscles on only one side of the face. Also in this case, the mouth appears crooked, the lids of one eye do not close, and there is a feeling of heaviness and numbness in the face. Stroke, unlike Bell's palsy, typically affects only the lower part of the face, such as the mouth. However, this is not always the case, so it is still necessary to call the emergency services as soon as possible. The patient should be asked to raise both arms forward. In the event of a stroke, one of the two will not be able to stand up and will fall down. Pain that radiates down the arm, in most cases the left, can also be due to a heart attack. In this case, however, chest pain is usually also felt, and the person having a heart attack may be able to raise both arms despite the pain. You need to check if the patient can speak and understand what you are saying. Ask him to repeat a very simple phrase, like "the sky is blue." If he doesn't get it right, it could be a sign of a stroke. If one or more of the signs described so far are present, call 911 immediately. Stroke is a time-dependent disease where millions of brain cells are destroyed every minute. The maximum effectiveness of reperfusion treatments, that is those that allow the return of blood flow in the areas where ischemia has occurred, is obtained if they are undertaken within 4-6 hours of the onset of symptoms. Intervening in this window of time makes it possible to reduce mortality and the disabling consequences that the stroke brings with it.